Well, good morning, everybody. You are most welcome to the first of our webinar presentations for our alumni and our member organisations. It's a very damp and drizzly morning here in the south of England. I hope you're having better weather. But why I'm saying that is that your morning will be brightened up by the presentation you're about to hear from Jacqui Reilly. Let me, I'll first introduce you to Gemma Stacey, and Gemma's going to introduce Jacqui. But thank you so much for giving up some time this morning to try and understand a little bit more about developing political acumen and gaining influence. And we are very grateful for Jacqui to spend her spare time developing this for us. And thank you so much, Jacqui. Gemma, let me hand over to you.
Thank you, Greta. So welcome everybody. And as Greta said, this is the first of our workshop-based webinars as part of our membership and alumni programme. So you're very welcome joining us, and thank you to Jacqui for kicking off our programme with such a fantastic focus and topic. So for those of you that don't know Jacqui or haven't had opportunity to look into her background, currently Jacqui is the Director of Nursing at National Services Scotland, and also has a joint appointment with Glasgow Caledonian University as a Professor of Infection Prevention. She has such a vast knowledge and experience and has published extensively in the area of infection prevention control. And to such an extent, she has influenced guidelines nationally and internationally. You won't be surprised, therefore, that she was very influential and continues to be very influential in the COVID-19 response at government level, and has actually chaired several of the subgroups and is a member of the SAGE group as well. We're also thrilled that Jacqui joins the Florence Nightingale Foundation as one of our external advisors, and she's actually the chair for our membership advisory group. So it's such a great asset to us as a foundation, and we really do believe that in having Jacqui's knowledge and experience and networks associated with us as a foundation, we can start to develop our own political acumen and as a foundation have the kinds of influence that she has demonstrated in her career so far. So the way that the webinar is going to work is Jacqui's going to take us through some slides for about 30 minutes, and then we'll be able to open up to questions. Now, because we're in this webinar function of Zoom, that means we can't ask questions live, unfortunately. So if you could use the chat box to put your questions to Jacqui, add them in throughout the whole of the presentation, and I will pose those to her at the end of her presentation. So thank you so much for joining us, Jacqui. I'll hand over to you now for the first part of your presentation.
Thanks, Gemma. It's an absolute delight to be with you all today from a very snowy west of Scotland. There's about 2 inches lying in freezing fog outside my window. So it's rather chilly out here, and I'm delighted to be in the lovely warmth of this webinar for the next hour. So thank you. So in this next 30 minutes or so, I'm going to overview a little bit of an introduction to me, where I am and why I got here and why it matters. And then some of the theory and some of my own lessons learned as they relate to developing political acumen. And then focusing on gaining influence and what the principles are there and what I've learned. And then finally, in the second half of the presentation, I'm going to overview some lessons learned in the context of the pandemic, and in particular, tell you a story about taking a seat at the table, taking opportunities, and using political acumen in influencing national policy. So my day job, as Gemma said, is Director of Nursing in National Services Scotland. And we have a whole range of nursing services. We have the blood donation service, clinical apheresis service, and we also have a lot of nursing specialist services, such as the National Infection Control Service is there, Occupational Health Service, as well as nurses that work in clinical informatics, procurement and commissioning. So it's an amazing array of specialist and generalist nurses that have influence actually nationally across all of the boards in terms of national guidance, but also in terms of the actual practice that they enact. So our blood transfusion service is a national one that's based across all of the regions in Scotland. And I'm joint appointed, as Gemma said. I've been a clinical academic for the last 20 years. And I was reflecting on that this morning when I was speaking to Gemma and realising how old I'm getting. But I lead a team of researchers at Glasgow Caledonian University, and they're called the SHIP research team, so Safeguarding Health Through Infection Prevention. And this team, who you can see there are all doing the jazz hands, are focused on infection prevention and control, and the jazz hands are the international sign of hand hygiene. So that's why every photo you see of the team, they have that. And they've done an amazing amount of work on all sorts of infection prevention and control, research, hand hygiene, screening, antibiotic prescribing, all sorts of things that's impacted quite widely on national policy and practice over the last 15 years, but also in terms of its reach internationally. So we were involved in the work that the World Health Organization now call the core components for infection prevention and control. And in fact, myself and my colleagues in the team provide expertise to the World Health Organization. So quite a lot of reach and influence, but it takes a long time to get all of that. And I have to say, 20 years ago, if you'd told me this is what I was doing, I wouldn't have believed you. And when I first started in the university 20 years ago, after doing my PhD, there was me and me alone. So it shows you what can grow over time when you think about some of the things we're going to talk about in the presentation today. So why does this matter? So political acumen development and gaining influence has been important to me throughout my whole journey of both my academic and my clinical career. So in the clinical leadership journey in the NHS, whether I was, as I was in my first job, a staff nurse in a care home, and thinking about, spotting things in practice that you think need improving. And I'll tell you a little story about one of them, which was my first week in job, the matron of the care home said to me, "Have you spotted anything you think we need to change?" And at the time I had, so I said to her, "Well, I don't think you're supposed to use urine jugs to empty catheters anymore. At least we didn't do that in our training." And she said, "Oh, right, we'll get that changed." Within a day, it was changed. So it's amazing the impact you can have even in your first job in the first week if you speak up and have the courage to say that what you think needs changed. But all the way across my leadership journey, because I've worked locally and nationally in public health, thinking about who it is you need to connect to make those changes. But also in the academic side of things, in academia, a lot of what happens and how successful you are hangs on how much funding you get. And when you learn about how to influence that and make an impact in terms of reach and significance, both internally within your academic institution, but also externally in terms of how you connect to some of the major players internationally, it really matters all the way along the journey. So the first up is developing political acumen. So political acumen is the ability to accurately perceive and judge the formal and informal influences that shape decision making. So it's really a leadership skill. And it's about accuracy and keenness of judgment or insight. So it's not about being political per se. It's not about being a master manipulator, which is how some people think about it. It's more about manoeuvring for influence. And I like to think of it more like akin to a game of chess. If you know the rules and you've practiced, it's amazing how much success you'll have. And in thinking about how you operate in terms of yourself within the system and how you influence, a good way to think about it is your own circle of influence and your own development. So Stephen Covey in his 7 Habits of Highly Effective People talks about your circle of influence and making sure that you focus your efforts where you can have that impact. So there's what you could decide yourself. There's the influence in that yellow circle of people that you have influence over, whether that's the team that you work with day to day, or whether it's people within your network. And then there are those things that are beyond that yellow circle and within the purple one that are outside your influence. And so you should spend your time where you can have the influence inside the yellow circle and look to see how much reach you can get into the outer circle, but not get frustrated that you can't influence beyond that piece, because you can't influence everyone. And this reflects quite nicely with what Philip Derbyshire has said about how we really think about academic freedom and freedom of voice clinically, and making sure that whatever we think about in terms of trying to influence, we base it as much as we can on evidence and science. And these may be contested and they might evolve over time, and never a truer word than during a pandemic. But they are the essence of how we base much of what is decided in policy. So it's really important to have that firm evidence base. And when I mentioned that it's about leadership development, it is in the context of thinking about the system. So when you think about policy, policy sits in a system, and that system needs people to be able to connect the parts of the system in order to influence it. So in developing yourself, you need to think about the system, and systems thinking and leadership is a really prevalent development currently in much of nursing leadership programmes. So it's about how you think about each action that you have and its reaction in the system, but also how you making changes in one part of the system impact the other. And also being open to different ways of knowing, understanding the perspectives of others, and really being kind in the way that you operate within that system. So in thinking about political acumen, you need to think about yourself, the team that you work in, the organisation that you work in, and then nationally how that might operate, and then how that operates within the world system. So we're one part of a much massive system. So in doing that, we can improve our agility in negotiating and working through complexity. And we can also create capacity for building wider alliances or coalitions of the willing that want to work with us. And we can always find better ways of doing things. I'm always amazed every time I meet people from all different walks of life and internationally, how much I learn. And the more people you meet and the more wide your network becomes, the more you learn. And also it allows you to begin to design ways and bring that learning into the way that your current work practices are. And it was nicely summarised by Elaine Maxwell, as one of the thought leaders in nursing, I think. Last year in one of her blogs, she said, you know, not to work with countries at an international level is a missed opportunity. And it really is. So it's really important that we all think, no matter where we work in the system, how we connect to that wider system. So what have I learned about developing political acumen? So I think it's about developing yourself as a system leader, investing and in growing the relationships of the people that you work with, but also with intent, joining important groups and growing your network, and ensuring that you respect everyone around you, because any decision that you may wish to make in the context of the system has an influence in other parts of the system. And then continuing to develop your knowledge base, making sure that you're credible, and this connects to the political influencing part that I'll come to. And then finally, choosing your moments well. So it's amazing how quiet voices are heard when they speak. And so exercising any power that you may yield, and whether it's an award, whether it's in a care home, whether it's in the community, or whether it's in government, exercising that wisely is really important. So those are the key things I've learned about political acumen. In the context of influencing policy, understanding and influencing policy is really about three key factors that influence how policy is enacted. So the first is developing deep knowledge. You really need to know a lot about the topic that you're trying to influence. The second, and it relates to the political acumen point, is building networks. And the third is participating for extended periods of time. And there's quite a broad evidence base that demonstrates if you can do those three things, your success will be much improved. So those are the three factors that we need to consider. And in influencing policy, you really need to understand how the system works. Now, the UK is quite a complex system in terms of local and national policy, and understanding how that fits together is really important. So, for example, health is devolved as policy within the UK, and that means that each of the devolved governments can make its own health policy in the most part. So if, for example, like me, you work in Scotland and you want to influence what's happening in Scotland, your route to that influence will be in the Scottish Government. And you need to think about where in the Scottish Government would that policy be influenced. So if you're working in a care home or in the community locally, wherever you are, your route to connect to that may be through local politicians, or it may be through your professional routes within your organisation that then go up to people that work in government and professional advisory roles. So in the most part, we would default to thinking, well, we've got a route to the Chief Nursing Officer. And that's entirely true for nursing policy per se. But many of the policies that we might want to influence are about nursing, but they may not necessarily sit in the portfolio of the Chief Nursing Officer. So they may sit in, for example, the mental health directorates, or they may sit in adult social care. And so your route to connect to those may still be through the Chief Nursing Officer in that professional route, but it may also be other civil servants or other leaders within government. So understanding where all the points of access are and influence are really, really important. And then thinking about how ministers who make policy interact with that system is really important. So as I said earlier on, if you were trying to influence something locally about, for example, a local hospital and the services that were there, your route to influence actually might be your local councillor or local politicians, and those routes actually to ministers are quite direct. Whereas if you're trying to influence something nationally, then the route to that may be better via a national organisation that has responsibility for the topic, and then through them to government, because their opportunity to influence will be much bigger than yours as an individual. So influencing those decision makers and being seen and heard and having that political acumen are also important things in the context of thinking about influencing policy. And just to give you an example, and you'll be wondering, why have I got MRSA screening on that slide? Many years ago, I was doing a piece of work that was around an evaluation, a piece of research that was an evaluation of the best way to screen people when they came into hospital as admission for MRSA. And in doing that piece of work, we identified that there was a much better way than screening everyone. You could ask everyone 3 questions and then test them, and that would mean that you saved the NHS in Scotland £7.5 million a year, and it was just as effective. But there was a manifesto commitment from the government that there would be universal screening for MRSA. So what we had to do was work with the civil servants in order to try and frame what the findings were, because it was the right thing to do, but for it to connect to that manifesto commitment. So what we called it was universal MRSA screening, rather than the commitment in the manifesto, which was every patient coming to hospital would be tested for MRSA. So some of it's about language and framing and making sure that you get the right thing done. So I wanted to just touch on quickly the fact that there are many, many factors that drive policy change, and it'd be quite frustrating sometimes when you think you know what the right thing is to do, and you maybe have evidence that it is the right thing to do, but you just can't land it. One of the things I found really helpful is thinking about all the other influences for policy. Now, this is one diagram that we've used actually for the kind of One Health Antimicrobial Resistance agenda, which is why you'll see some unusual terms in it. But it in effect shows you all the whole variety of policy change factors. And you can see there in the little red circle that knowledge and research is one of a whole myriad of things that are informing policy. So understanding that and having perspective can help you not get frustrated when you understand how the system works. So what have I learned about political influencing? So I've learned about how academia works, and as I mentioned before, that's about building those networks, working collaboratively, gaining that traction and making sure that you can generate funding. And when you generate funding, what you tend to find is internally within the university, it will also attract additional support. So all of those things matter. Also, how health and care works, as I've mentioned, whether it's that local route via politics with a small p within the organisation you work with, or politics with a big P, which is the local councillor and up to ministers, but also nationally, in terms of the way that your route through national organisations can really strengthen your ability to influence policy. So an example there with the MRSA screening was the route to that was through the National Public Health Organisation up to government, who are strongly influential in policy. And then also understanding how the civil service works. Civil servants are an unusual breed compared to those that work in healthcare. And their skills are general skills, but they become very expert in the policy areas that they work in. And the skill that they have of working with ministers is about being able to communicate quite complex things with options for the way forward, and being really honest about the risks, but not in a way that is resistant to the minister's preferred direction of travel. So that example that I gave you with the MRSA screening demonstrates that perfectly. So lessons learned from COVID. So you'll be aware that there's been much said about the SAGE committees and who's on them, and the government's response therein. And interestingly, when pandemics or big events have happened historically, it tends to be the chief medical officer with all of the medical leads in particular topics. In this case, respiratory infection, epidemiology, immunology are the people that are around the table, as well as modelers and epidemiologists. And there's a call on social media around the voice of nursing at those tables, particularly given that some of the system changes that are needed in response to the pandemic are nursing-led, but also because infection prevention and control as a specialty tends to have a very strong nursing voice. So in thinking about the need for visible nursing leadership during COVID, there have been wider international calls for this, and really emphasising the importance of visibility in a multidisciplinary way at the table to encourage interprofessional collaborative decision making, especially in a time of crisis when pace is needed. So decisions that are made at a table about workforce, for example, in relation to vaccination, have huge ripples across the system, and insight into how that might work would be helpful, and that would be helpful if there was that interdisciplinary piece around the table. But most of us have been just getting on with doing the job, quietly influencing the change that's needed. So I'm sure in your own organisations you will have a whole myriad of examples that I'd like to hear about. But in my own organisation, we've developed convalescent plasma as a new service in our blood transfusion. We've got a new occupational health service around delivery of the COVID vaccination. We have built the Scottish Nightingale Hospital, which is called the Louisa Jordan. Many of our staff were involved in that. We've increased our staff and student placements, mainly because in hospital settings in particular, in some of our care homes, student placements have been challenging in terms of physical distancing ability. So we've managed to increase those, particularly in our blood transfusion service. We're giving specialist advice. We produce all the national guidance for infection control in Scotland. And we're also involved in procuring all the PPE, and we've developed clinical leadership of all of that. So quietly getting on with all of the things that were needed anyway, without necessarily having those seats at the table. And also in the academic team, the team there are doing evidence-based reviews at pace, and making sure that they're involved in research that is contributing to the COVID effort and leading those studies, working with wider networks than they ordinarily would to make sure that we can get things done at pace. And they're taking a completely different approach to some of the work that they do in community engagement. This is Professor Snott, who does all our community engagement, predominantly with children, basically promoting hand hygiene and respiratory etiquette. So we're doing these things virtually at the moment. So lots of ways of flexing to meet the need and making that change. But COVID was the perfect storm, you might argue, for actually really gaining influence and getting a seat at the table, particularly because the director of the European Centre for Disease Control recognised about a month into the pandemic, when we'd reached the first peak, that what we have learned is that the non-pharmaceutical measures, infection prevention and control, are recognised to be having an effect on reducing transmission. And until such times as we have a vaccine, which is coming but still not here, those are all we've got. So it was recognised certainly in Scotland that we needed infection prevention and control expertise at some of the senior tables, making decisions and making sure the evidence base was there. So I was invited onto the Chief Medical Officer's C19 advisory group in Scotland. So that's, if you like, the mixed age group. And it's of interest that I'm the only nurse that's on it and has ever been on it. The Scottish Government Advisory Group on Care Homes and Public Health Threats I was co-opted onto. The UK SAGE subgroup I asked to get onto, and it sort of made me think about something Joe Bosanquet, who for many years has been a friend of mine, and said, if you don't have a seat, bring your own. And I think there is a little bit of push that's needed for some of these things. And I've also chaired a couple of groups. But what I want to talk to you about in the last few minutes of the presentation is I was invited to independently review care home outbreaks in Scotland. And I want to just do some lessons learned from that. So, as you might imagine, all those things I've listed there in effect became a new day job, and it would be very easy to say no because I had lots going on in my day job anyway. And I've managed to negotiate that my university time has been spent on the COVID efforts, so it doesn't impact on my Director of Nursing job as badly. But you're always faced with these decisions in life. You know, you may have agency, and I am choosing to act with purpose and contribute my expertise. But then you also maybe have some power about whether your ability is there to act with that purpose. And it does take courage. And I know that the Florence Nightingale Foundation frontline leadership groups have been looking at the aspects of courage that are needed for all of us in our variety of roles. So one of the greatest freedoms is that we have as individuals is how we choose to react to things. So my choice was to proceed. So a real world example, I've called it Care Homes, COVID and Swiss Cheese. I'm going to hang what I say in the next few slides on this framework for how you put knowledge and reason into the heart of political decision making. And this is a European Union commissioned piece of work that's really nice. And for each of those parts of political decision making, they've got quotes in this report. So I'm using the quotes to tell the story. So the first is that stories constitute a really single powerful weapon in a leader's arsenal. And actually stories are one of the things that impact on policy. So in the care home situation in the UK, Scotland is no different to the rest of the UK, and the UK is no different to any country across the rest of the world. Care homes have been hit really, really badly with COVID-19. And some of that is about the intrinsic risks, some of that is about the actual care setting, and some of that is about preparedness. And unintended consequences of putting public health measures into care homes, such as restricted visiting, have meant that there's real challenge rightly around how we compassionately enable care, in particular infection prevention and control measures. So it's a huge political issue currently. And we know that care homes have the 3 C's, which is the high risk of COVID. They are closed spaces, they are crowded, there's lots of people together in them, and there's close contact because they're not designed for isolation and they're not designed for physical distancing. And there was evidence during the pandemic in the first peak that there was a higher risk in homes that were larger, that had higher occupancy, and that had older adults with incapacity. And this is a measure of footfall, but also a measure of how challenging it is to isolate in someone's own home, which is what a care home is. So a Scottish care home experience was similar to the rest of the UK. In the first peak, around a third of the care homes had experienced an outbreak. And at the time we were asked to do this review, just in October, around 10% of care homes in Scotland had 1 or more cases of COVID in this second peak. So clearly, system thinking for the defences was needed. So they ask, now I was asked, so you could argue that I was empowered. So I was asked to do the review, understand the common characteristics and risk factors and outbreaks in care homes. And we were given 4 care homes who have had high attack rates during that period and asked to investigate those and make some recommendations to government. So we had power, I had some agency, and we had some influence. But obviously you need the right people around about you to make things happen. So we, in thinking about the approach, decided we would use appreciative inquiry so that we were fact-finding rather than fault-finding. We engaged with the local organisations, care home managers, senior staff, as well as DPHs and oversight boards and the health boards and the integrated joint boards. We also engaged with the national organisations because we wanted to sense check what we were finding in these local experiences was reflected in what was needed nationally. So we engaged quite broadly with all of those people. And it was 3 people that were in the review team. It was myself, a director of social work, and someone who was a specialist in root cause analysis. So we believed that if we could act as honest knowledge brokers with all of those parties at the table, that we could enhance the trustworthiness of the science and government and make sure that policy was based on that. So the approach we were given was to follow an adverse incident investigation process. What we decided to do was to also desktop review all the data, establish a reference group to oversee it, use interviews in a way to really dig deep about what was actually going on, summarise all of those thematically in Ishikawa analysis, which I'll come to, and then make recommendations at the system level. We made a decision, not that we were given permission to, but we just proceeded until we were apprehended kind of way. We made a decision not to name any of the homes. We made a decision to use them as a reference group and to only make recommendations for the system, because that was really needed. So in creating that environment of psychological safety, we're going to make sure that policy was really fit for purpose. So the factors that influence whether care homes get high attack rates or not are a whole myriad of things. And this approach to thinking about safety is James Reason's Swiss cheese model. And basically what it says, if you think about it, is there's a whole layer of defences that we can put up to try and stop COVID getting into care homes. And they start way back at the left-hand side there, which is the big block of cheese, which is what's going on in the community. If you suppress the community transmission, then it won't get into care homes. And then there's what the care home workers do outside of work. And then there's all the things that we need to do day to day in our practice to make sure that the care home is safe. But when community prevalence rises, and you can see there in the middle of the cheese, there's a wee mouse eating the cheese. When the community prevalence rises, it tears away the defences, because if you think about it, everyone in the community has got COVID, and then anyone coming in and out of the care home is going to be likely at risk. So as a result of that, there's other things you need to do. And so all of those feature in the current guidance. We found that a whole myriad of things were going on across those 4 homes. Things to do with equipment, the environment, how easy it is, as I said, to isolate, testing and the testing system, and the turnaround time of the tests was not supporting the care homes. The data that they had, and the fact that they actually, some of them didn't have any computers and infrastructure digitally, was not helpful. It meant that they were reliant on telephone calls about positive cases, and how those were communicated was critical, and all sorts of things around people and inspection and all. So you can imagine, if we were to write a report with recommendations on all of that, it would probably not be particularly helpful. So we looked at where these themes were common to 2 or more homes, and the wider reference group thought they were important contextually for learning in Scotland across the system. And there's always another way to say the same thing that doesn't look like the way you said it before. So this important point that I made earlier on around framing. So what we did was made system level themes and recommendations about digital enablement to help the care homes, around early warning systems that might help the care homes, around trigger points that would enable them to scale up the things that they need to do to control, making the testing better so that they get results in a quicker time and can act quicker, and ensuring that they have access to expertise. So many of them had no access to infection prevention control expertise. And so all of those things were fed back to Scottish Government. So the whole system supported the report because we thought about it at system level. No one felt they were blamed in any way, and none of the homes were named or shamed, which is what the newspapers had been doing to date. The government published a winter plan the day they published our report, and accepted all of the recommendations that we made, and are now enacting new policy and guidance. And the European Centre for Disease Control picked it up and have published it and shared it across all of the countries in Europe as an opportunity for everyone to learn from those actions. So the action plan that's now in place is influencing care policy and practice. I think this is a really nice example that shows the power of shared purpose and gaining agency during the pandemic and its potential impact. So, in summary, do the preparedness work, make yourself a useful resource, self-develop yourself as a systems leader. Influence in a context-specific way. Where you work and what you know is where your best influence is. But grow your network and grow your circle of influence. And doing all that, self-development will put you in that preparedness space for when opportunities arise. Take those opportunities when they do arise. Have courage. It's not easy, but it's really worthwhile. And consider that agency you have, the power and the purpose. Those three threads of empowerment are critical, both in terms of that political acumen, but also in terms of the policy influence. Focus on the science and think about the framing. So be clever with the use of language and think about what people want to hear and how what you've got could be said in that way. And think about the system, because then you have shared purpose with other people. And my final things are just to stay person-centred and be kind to yourself. Sometimes I have to say that my imposter syndrome has been on steroids during this whole crisis, but my wee dog Smudge, who's in the picture here, and this is just an excuse to get him in any presentation, he gives me great comfort in my moments of questioning myself. So I'm going to think about what this means for nursing and policy. It's about knowledge, it's about leadership, and it's about involvement. And so the greater engagement of nurses in policy making will demonstrate that all of that can benefit families and society as a whole. So I'm finishing with my favourite slide of choice at the moment, which is Pooh Bear. And it's probably how we're all going to feel after this. So how will we know when all this IPC guidance is going to work? Well, the world will probably think we've overreacted. And so even if we're right about all the stuff we've been doing, everyone will think we're wrong. And that's what working in infection control is all about. So thank you.
Thank you so much, Jacqui. That was wonderful. Really, really excellent. So much to think about. And we've got some great questions that have come through as well for you. So we had a question from Biz in the chat box that asked around, if you find yourself hitting a dead end when you're going through those traditional routes to influence, how would you suggest we circumnavigate that without being seen to go over somebody's head?
So, I mean, it depends on the circumstance, but I think you can quietly influence in other networks. So, I mean, the Florence Nightingale Foundation is a marvellous one, for example. So our members group enables you to influence policy and practice in that wider professional circle that's outside your organisation. So those sorts of professional circles are a nice way to go with ideas that you may have that maybe at first are not landing locally. So there may be another route around it. So I would suggest that principle I said about growing your network and intentionally joining forums is a really good way to do that.
Brilliant, thank you, Jacqui. And another question about you talked about being both an academic and influential in the clinical areas, and I think you were a clinical academic before even the term was known or in place. But I wonder, do you think or see it as easier to influence from your academic role or from your practice role?
So I would say that they're both challenging, and it varies depending on what role you're in. So one of my more recent roles before I was a director of nursing, I was actually working as a consultant epidemiologist in the public health body. And in that role, because your role was to give advice to government, it does make policy advice giving somewhat easier, which is why I'm saying if you think about those organisations that have that function to give advice, if your topic connects to them, that's the forum you want to be in, that's the people you want to. So those things are important. In academia, I think it's the same thing. I would say early on in my academic career, it was really hard and it could be quite frustrating at times. You'd do a nice study and you'd find something you think is the most important thing in the world, and it goes nowhere. And you're so disappointed. You publish it and then nothing happens. But actually, sometimes the most unusual things that you do will have a much bigger impact. So for many years, I was publishing really big epidemiology studies, and you know, they got into nice journals and they might have made some influence, but there was nothing that really went, you know, really wowee. And actually, when I met Greta for the first time, I told her this story, but when I published the smallest study I've ever done, which was a study of hand hygiene in doctors and nurses in a hospital in the west of Scotland, It was a small randomised controlled trial of, a couple of hundred nurses and doctors. Now, that study was the smallest study I'd ever done. And that study made the New York Times, the Washington Post, there was videos made about it. It went viral and it was absolutely crazy. And so it was because we were challenging something that was a policy at the Centre for Disease Control in America. So interestingly, it was how it was framed, which relates to how you make influence. So sometimes you think this is really worthy research, but it's just not interesting enough and doesn't get picked up. Whereas other times, because this hand hygiene was almost framed by the newspapers as a battle between the World Health Organization, who had a different technique to the CDC, and we'd done a study of both, that resulted. So that's quite an important thing, thinking about how you frame things and thinking about how it will connect people, and it made it have legs and grow. And that one study resulted in us growing a whole bunch of networks, and the World Health Organization wanting to work with us. And so it just shows you that it's not necessarily how amazingly academic something is, it's just about how interesting it is and how it's framed.
Brilliant, thank you, Jacqui. And actually, a point from Nikki in the chat box really resonates with what you said. She said, "Thank you for an excellent presentation. It's so encouraging to hear that building the acumen is gradual and that preparedness is vital. It can feel like you're not achieving when you're not immediately seeing impacts, but very reassuring to hear that preparation is the key."
Yeah, but also, don't miss an opportunity along the way. So, even the story I told you about, like my first job as a care home nurse and the urine jug is a really important one, because that care home was part of the group, and that practice ended up rippled, changed, and part of their policy across that care home. So these small things that you think are important in the moment for your day-to-day practice can really ripple. So if an opportunity arises, no matter where you are in the system and what part of your career's in, you have that agency and you're empowered, take the opportunity to. So yeah.
Fantastic. And what tips could you give us, Jacqui, if we were thinking, okay, now having heard what you've said today, I do want to go and I want to start having that influence with politicians, the big P side of things. What would be your tips?
So I think much of the leadership development that's available to nurses encompasses some of the theory and the skills that I've only touched on today. So I would encourage people to think about accessing that. The Florence Nightingale Foundation has a whole bunch of stuff that people can access around that, which would be a great place to start. And then thinking about the growing your network piece, the more forums that you're in, and actually just watching how other people operate is actually a great way to learn. So I have a few people that I would see as role models over the years that I've watched how they are in meetings. I'm a bit of a chatter. I like a good chin wag, and I can be a little bit noisy in meetings. And I would say when I was earlier in my career, I was quite a loud voice at the table. I've sort of learned, as I said in the presentation, that actually, if you're a more quiet voice at a table when you speak, you'll really be heard. So that's why you choose your moments that you want to say things when they really matter, and then they'll land. So those sorts of things are things you can learn in experiential learning, but also that development of leadership development more formally and understanding some of the theory, I think are the key routes to it all.
Oh, wow, absolutely. And Jacqui, you mentioned towards the end of your presentation there about that issue of imposter phenomenon, and I mean, it was great to see your lovely doggy there as well, and to show that we all need that balance, don't we, in the work that we do. But I think sometimes people that are in positions as you are may perceive you as immune from those kind of feelings of imposter phenomenon, that you've somehow achieved a level that means you've surpassed those moments of self-doubt. I wonder if you might just elaborate a little bit more on that for us.
I actually think it's a great thing. And now there's moments where everyone has doubts, and I think you hold on to what you know, and my whole thing is I'm doing my best, and I tell myself that sometimes, particularly when you're tired and a little bit more vulnerable to the critic that you might have in your ear, you maybe feel that a little bit more. But I'm always struck by the people who are very senior, who have openly discussed this phenomena. And one of the people that I read about recently, funnily enough, was our First Minister in Scotland, Nicola Sturgeon. Now, she is on the television every day in Scotland and very confident, and I've met her, and she's hugely confident, very intelligent, and is probably the most senior leader in Scotland. And she says she's got imposter syndrome, so I think that makes it okay for anyone to have it. And I think you have it in different ways at different parts of your career. But each time, it's a bit like the Benner novice to expert phenomena. You know, each role you go into, you grow in that role, and then you maybe go into a different role and you're starting all over again. Mm-hmm. And for me, as a director of nursing, I've only been in this role for 2 years now. And when I went into this role, even going for an interview, I was thinking, I don't know if I'm good enough for this. I don't know if I just don't know if I can do it. And full of self-doubt. But then once you get into the role and you get used to it and you grow in your confidence, you have less of that challenge and that sort of internal headspace that you have around these things. Mm-hmm. But it's okay. It's okay to have imposter syndrome is my mantra.
Yes,
Maybe
embrace
does you good.
It. Yes, yes.
Stay humble.
and lots of comments in the chat box that saying the same, that actually this is a very reassuring to hear that that's the case. I guess, Jacqui, for many people, one of the most significant elements of your story was the moment when you said about asking to be sat around the SAGE table for the COVID-19 response. Could you tell us a little bit about what that has been like for you, your experience of being at that very central position?
So I think my experience of sitting at the CMO advisory group in Scotland was a really interesting one. It's a different type of meeting to those that I'd been in before. Very collegiate and really good, but basically you're there on your own merit. You're there because everyone around that table recognises that you have some expertise, and sometimes you will have expertise others won't. And so in my particular case, there were very few people around that table that knew very much about hand hygiene, although everyone thinks they do, but the science of it is actually very interesting. So I think you're there on your own merit, and that makes it easy. I think when we think about how the UK works, the UK SAGE group and the subgroups of it, which were topic specific, predominantly had membership from those CMO devolved groups. So there was a route in, probably enabled, so you could argue I was empowered, but it wasn't offered, so you almost had to ask. And so, you know, you are seeking permission, but there's a little bit of saying, actually, it would be really helpful. And I went in a couple of different routes. So some of my network that I have are on the group, or some of my network are connected into government civil servants that would be making the decisions about who's on the group. And so you use those existing networks that you have, and you just keep lobbying until people get so fed up that they'll let you in the door. So your chair is halfway through the door, and then eventually you've got your seat at the table. So I think persistence, perseverance, all the P's, and patience, those three things are needed sometimes, because it's really important. Because at that table now, we're joined up across the UK, everyone's learning from each other, and that's what really mattered. So that was my intent.
Fantastic. Thank you, Jacqui. I know Greta's listening and she's here patiently, and I know she'll want to make some comments and pull together our discussion. So Greta, could I hand over to you?
Thank you so much. Thanks, Gemma, for facilitating that question and answer session. Thank you, Jacqui, so much for your insights, your honesty, your humour, and I think so much has come through as Jacqui Reilly, as to why you have been so successful in your career. I was thinking all the while how this is significant so as the Chief Executive of Florence Nightingale Foundation, how this is significant today as it was in Florence's time, and what would Florence say to you today if she met you? And I think that she wasn't a drinker, but I think if she was a drinker, she would invite you to a glass of champagne, and I think that you would have the most enormous slap on the back for all of those elements of the things that she taught her probationers what to do, and how she enacted her whole of her life was through perseverance and persistence. And I think what you've shown to us in your presentation is a few take-home messages. And my first one is, to the people who are listening today is it takes a long time to have such an illustrious career, and don't give up. Believe in the thing that you're going to, you believe in the thing that you're so passionate about, and as you move roles, understand that for a while it's going to be uncomfortable, but then you get comfortable again. And it's okay to have a bit of self-doubt. I think that's human nature, and I think you from Nicola Sturgeon to Jacqui Reilly, you've identified that that's normal. People do that, but I guess the trick is to not allow other people to see that. And I guess how you've been so successful in the political field, and particularly around COVID, is making sure that you know your stuff. So really understand the science, and know the rules, and practice it until you, as you say, you get the whole chair through the doorway. And actually your experience and how you've had such an illustrious career is that you've developed yourself as a system leader with enormous network. And I think that's the thing that we identify with scholars in the foundation, is the bigger the network, the more influence you'll have. So I've thoroughly enjoyed this morning. Thank you so much, Jacqui, for your time. I'm sure we'll have you back again. We'd love to know lessons learned from COVID's phase 2. So really, thank you so much, Jacqui. Just so everybody knows, Jacqui is a special advisor to the Florence Nightingale Foundation and is chair of our recently launched FNF Academy membership. So once again, thank you, Jacqui. Thank you to everybody. I think there've been people coming in and out of this session, but I recognise a lot of the names that have been on the chat. So thank you for your contribution. And Gemma, just to let you, will this be available for people once it's finished as a recording?
Yes, so it's all been recorded, and we'll send it out to you, all of the members, so they can distribute it out amongst their teams, and it will be available to stream as well. So yes, those that weren't able to make it today will still get a chance to hear from Jacqui.
Well done. Thank you so much. Goodbye, everybody. Have a good rest of the day.
Thank you. Bye.
Bye, everyone.
Bye-bye.